welcome back to my channel, Nurse Netta. In today's video, I'm going to talk to you guys all about how we treat dog bites in the emergency department. So, number one, when you sustain a dog bite or someone you know, a loved one or a friend, has a dog bite, the number one thing you want to do, even before you come into the ER, try to rinse out that wound. So, if you are walking down the street or you're hiking or something like that and you don't have a bathroom accessible, if you have a water bottle, that's fine. You can use that as well. You just need to use something, a water source, to try to cleanse that wound. So, or if you're at home and it happened at home, go in the bathroom, put the wound under running water for about 5 minutes, I would say, just to make sure any bacteria, any dirt or debris from the dog's teeth will be cleansed out of your wound. And then you want to make sure you get a clean gauze or something clean to cover the wound, okay? And then you want to go to your hospital, your local emergency department to be treated. So when you arrive at the emergency department, one of the nurses, the number one thing we will do is assess the wound. So we want to assess the wound to see what type of wound it is. If it's a scratch or an abrasion and it's very superficial, is it a puncture wound where you can see the teeth marks, or is it a laceration? So we assess the wound to make sure what type of wound and the severity of the wound. Then we go ahead and we irrigate the wound. Now, irrigation is, we just use normal saline to flush out the wound, and that just further facilitates the cleansing process, okay? Now, depending on what type of wound you have, the provider will order x-rays. So if it's more of a superficial wound and the provider does not suspect any deep tissue injury, or something like that, x-rays probably will not be ordered. But in puncture wounds and in lacerations, especially when it comes to the hand or the leg or something like that, the ankle, they want to make sure there's no fractures or no underlying injuries, underneath the surface that we can't see with the naked eye. So x-rays might be ordered depending on the severity of the dog bite. Another thing that we do is we have to call animal control. So we have in our hospital, it's called a rough report, and it's literally a dog bite incident report that we fill out. So we put the name of the victim, the location that it happened, the type of wound that the victim sustained, and our treatment, like whether or not they needed stitches. You want to get the type of dog that bit you. If you have information about the owner, like first and last name, address, and phone number, we have to put that on that report as well. And then once that report is filled out by either the nurse or the provider, we fax it over to the county's animal control. And it has to be in the county that the bite happened in. So if the bite happened in Pomona, that's considered Los Angeles County, so we would fax the report to the Los Angeles County Animal Control. If it happened in Fontana or Rancho Cucamonga, we fax it over to San Bernardino County Animal Control. So, like I said, if you have just a superficial abrasion or scratch, like where the teeth just kind of grazed up against the skin and it's just very superficial to the surface, the provider more than likely will order us to, like I said, irrigate the wound, clean it really good, apply triple antibiotic ointment, and cover the wound. If it is puncture wounds, puncture marks, and the wound it's deep puncture marks, we irrigate the wound. The provider will do x-rays to make sure there's no foreign bodies in that wound. You'll be surprised what we see in the ER. It might be a piece of tooth chipped off. You don't know. So we just do x-rays just to make sure there's no foreign bodies in that wound. And like I said, cleanse it, apply triple antibiotic ointment, and cover the wound with a clean gauze and a bandage. Now, if it is a laceration, and I have seen horrible, horrible dog bites, especially it's common in kids, where the face is bitten. So either the lip, the cheek, or the forehead eyebrow area is affected. I see that a lot. That's very common. I've also seen bite marks that left lacerations on the abdomen, the thigh, the buttocks, and the leg. Rarely ever do I see hand wounds. That's more common in adults. But for little kids, they're closer to the face of the dog because they're short. So more than likely they have facial injuries. Now, if you have a laceration wound, the doctor or provider will order us to irrigate the wound really, really, really good with some normal saline. We'll set up the laceration repair kit. So you have a lac repair kit that just has the needles, syringes. It has, you know, all the sterile items that you need to do sutures. You need to get the actual sutures, so like the needle and thread that the doctor or provider will use to do stitches. You need to get the, what am I forgetting? The betadine. You need to get betadine, normal saline, 4x4 gauze, and lidocaine to numb the area. Depending on how bad the lacerations are, and more so with children, because they don't do well with stitches, we have LET. And LET is just a gel form of lidocaine with epinephrine, and I believe it's tetracaine. It's just a numbing agent, and we store it in the med room in the refrigerator. So it's like a cold, clear gel that we apply directly to the wound, and we leave it on. I usually put it on the wound or some gauze, and I just cover the wound and have them hold it there for about 15 to 20 minutes. The longer it's there, the better effect it will have in numbing that wound. After the LET is on that wound for about 15 to 20 minutes, the provider will go in and further numb the area with lidocaine, either with epinephrine or without epinephrine, depending on their preference. And so they'll just take a needle and syringe, inject the lidocaine around the wound where the sutures will be, and it takes about, I don't know, like probably like 30 to 60 seconds, I guess, for the numbing medication to take full effect, and then they'll start the suturing process. Once they're done with the sutures, we just clean the betadine off the skin, because betadine, if betadine is left on the skin, it could kind of burn the skin, and we don't want that. So we just cleanse the betadine off with some normal saline, or any dry blood that's left over on the skin. We make sure it's nice and clean. We apply the triple antibiotic ointment directly on the wound. I usually put a non-adherent dressing so it's not sticking to the skin, and then I'll put gauze, clean gauze, and just tape it in place. Also, we administer antibiotics just to prevent any infections that might occur from the dog bite. With dog bites, I think it's 2 to 5% of the cases end in infection. So it's not very common, but sometimes, you know, it can get infected, especially with poor wound care at home. So we usually administer the first dose of antibiotics, sometimes, not all the time, depending on how bad the wound is. And we will send the patient home with a prescription for antibiotics. Let me see what else. Oh, we have to update their tetanus vaccine. So if you're not up to date with your tetanus vaccine, I usually give the tetanus shots just to prevent tetanus, which is infection that causes lockjaw. Let's see, I think that's pretty much it. So cleanse the wound, we treat the wound, whether it's just with gauze to cover the wound or with sutures for lacerations. We do x-rays, antibiotics, tetanus vaccine, make sure it's up to date. And that's pretty much it. You want to follow up with your primary doctor in 2 to 3 days just to make sure the wound is healing good and there's no signs of infection. And then if you do get sutures, those sutures have to come out within, I think it's 5 to 7 days.
Coronavirus!
Excuse me. So within 5 to 7 days. And that's pretty much it. So it's a very simple process, but the experience can be very traumatic, especially for the little kids. I feel so bad, but dog bites are very common, and it's a very common thing that I see in the ER and that I treat as a LVN. And almost every shift I work, or every week at least, I see a dog bite victim. So it's very common. And that's pretty much all that I have for this video today. I'm going to be doing more videos like this, treatment type videos that I see, you know, in the ER. So if you guys have any recommendations, or if you have any suggestions on what you want to see, I don't deal with critical care patients as an LVN. Those are patients that go to the RN. So I'm not going to be dealing with, I mean, I interact with those type of patients, but on a one-on-one nurse to patient basis. I'm not going to have those patients assigned to me. When it comes to stroke, heart attack, cardiac arrest, stuff like that, I don't typically deal with one-on-one. I do see and hear about the treatments, but I'm more so of like the lesser severe conditions that come through the ER. But if you guys have any suggestions, let me know in the comment box. And until my next video, thank you guys for tuning in. Like, share, subscribe to my channel, and peace.